The first responders of the COVID era are our doctors and nurses. They have stepped up to the task of saving lives with or without protective gear and medical supplies. Several, well, many more than several actually, have lost their lives in the process. Today we are joined by Joann Gull, Chief Nursing Officer of Elmhurst Hospital in Queens, and in Queens, New York, and Dr. Nisha Mehta, founder of Physician Community, an online community of physicians. Welcome to you both, and thank you. I mean, I really, my heart goes out to those folks that have been risking their lives on the front line, and both of you have dealt with this. Let me just start with Dr. Gull for a moment, and basically, or Joann Gull, and just talk to us for a minute. Oops, excuse me. Talk to us a minute about what the front line of this was like. Just take us back into the world you were in, because you were in the epicenter of this, and people, you know, just take us back there for a moment and kind of remind people what we had to deal with then and what we have to deal with today, and those people on the front line.
Back in March, I think we were a little bit ahead of other places, and we began to see a few cases come into the hospital. And then it seemed like it almost was like a tidal wave, that we became overwhelmed with patients presenting in the emergency room who had symptoms, who wanted testing, you know, our original units we had planned for putting COVID patients on rapidly became full. And we had to then, you know, quickly change most of our units into COVID type units. You know, most of the patients had very high oxygen needs. The staff had to quickly learn how to manage the patients that we were receiving. So I think it was
so it was like dealing with with the tsunami.
Yeah, exactly. That's the right word.
Well, let me bring in Dr. Yeah, let me bring in Dr. Mehta for a moment, because Dr. Mehta, you've been very focused on trying to make sure these frontline workers have the support they need, have the materials they need, have the PPE. So tell us a bit about your efforts there and how you've been working together.
Sure, Steve, thanks for having me on today. I'm really excited to be here, but also just really excited to talk about a topic that I'm really passionate about, not just because it affects myself as a physician and my colleagues as healthcare workers, but because I think there's a real public health issue involved with not protecting our front lines. And I think that that is something that, you know, in the large scheme of all of the things that we're dealing with right now in regards to this pandemic on so many different levels, right? Not just on a health level, but on an economic level, there's just a lot of noise. And one thing that I think gets forgotten sometimes, understandably because of the context of what's going on, but is the importance of really making sure that we have the skills that we need and the tools that we need to be able to address this adequately. And so what we saw on our end of things, as we were talking to physicians around the country, is and other healthcare workers throughout the country, is that everyone was feeling overwhelmed. Like Joann was saying, you know, there was just this tsunami of needs, and we were saying we don't have the personal protective equipment that we need to be able to deal with this. We don't have the protections in place, even from the standpoint of we're not just physicians or nurses or other healthcare workers. We're also people, and we have families, and we have concerns on that end of things. And we've got practices that we're running, and those are not only you know, a lot of people forget that physician practices are small businesses too, and we're facing the same economic concerns. And what happens on a public health standpoint, from a public health standpoint, if these practices shut down because they're not financially viable and they don't have the protections that they need, what does that do to our healthcare system in terms of collapsing that front line of community care and what is happening in the context of our emergency rooms? So what we really came together to do as a healthcare worker community was to try to come together and put together a list of all the things that we felt like we needed in order to really just focus on the task at hand in terms of taking care of patients and not worry so much about all these other things that were going on in the background that were posing significant challenges to our ability to be able to effectively deliver that care.
Right.
And so what we did was bring the opinions of over 100,000 physicians and taking the input of our other healthcare worker colleagues to put together this document that really said, these are the things that we need. And we
Right.
delivered that to Congress and have been advocating for those provisions.
And that's the CPPPA?
Yes, that's the COVID-19 Physician Protection Act. We call it C3PA because those P's get a little confusing. But what we try to do in there, and it's not just for physicians, it's just called, it has the physician term in it because it was brought forth by physicians. But we're really trying to protect all healthcare workers with that legislation and trying to get those provisions enacted such that we don't have to worry about all of those other things and can really focus on healthcare.
Well, Joann, thank you, Nisha. Joann, let me ask you about the shift and change. I was looking at a company like 3M, for instance, which makes respirators, is now making about 100 million respirators a month. So about 1.2 billion a year in the United States right now, more elsewhere in the world. And I hear from them that that still isn't enough, that demand is still far greater than even that astronomical supply which has been surged up. What is the situation as you've seen it now? Are frontline healthcare workers largely getting what they need in the universe that you're seeing, or do you still see large deficits there?
No, we have enough PPE. We actually were very fortunate that we had enough PPE at the very onset of the pandemic. So it's not really an issue for us, but I could imagine that hospital, considering the amount of need throughout the country, that it would severely be a problem, getting to every single institution.
Right. I mean, right now, and I just discussed it with Dr. Fauci, in particularly some of the southern states, the Sun Belt states, there is this just sizable surge of new cases and infections and hospitalizations. So in places like Houston, in Arizona, we're beginning to see hospital systems at capacity. What counsel and advice from your experience would you share with those that are seeing these surges right now?
They really need to look at how they're dispersing their patients. You really need to begin to create new ICU space very rapidly and to take a look at your total institution and figure out where you could create more space, because I could tell you we went from like 29 ICU beds to 160 at the real height of the pandemic. And you really have to plan, unfortunately, as you're going through the pandemic, but plan quickly and implement.
What would you, let me just jump back to Nisha for a moment, Nisha Mehta, ask you to tell us some of the stories you've seen, because I know that you know a lot of these physicians, and I think one of the things we're going to be discussing later in the show is the state of mental health, just generally, and with lockdowns, shutdowns, people scared and worried. But I've been worried about the mental health of those people who have to walk into a war zone every day. So what would you like our community watching right now to know about what we need to be thinking about when it comes to the mental health of these frontline practitioners?
Absolutely. I just want to touch very briefly upon, and I know that PPE has been, publicized to the wazoo. I think the one thing that I wanted to echo is also, although at a hospital level, Elmhurst may be doing well with PPE, that's certainly not what we're seeing across the country in terms of people not having to reuse masks, and especially in the community setting, right? Just because our hospitals may have stockpiled PPE, we're still seeing a very real dearth of adequate protective equipment in the hospital, outside of the hospital setting in our community practices. And so that's definitely also an issue. But I know we've touched on that a lot. Getting to the healthcare issue, which I think is, the mental health issue, which I think is so important, right? What we see and what we saw back in March and what we're starting to see now are these real secondary effects of dealing every day with death on the scale that we're dealing with, and being, we all have these different precautions in our hospitals now where people are not being able to come and see their family members. And so in a lot of cases, the healthcare workers are the ones who are with patients as they're dying, or with them as they're saying their goodbyes to their family members over the phone. And I think seeing that on a daily basis and not having your own normal constructs in terms of dealing with the things that you deal with in healthcare on a very daily basis, even outside of the pandemic, in terms of being able to come home and see your family and get a hug and all of those sorts of things that just really have been changed, right? A lot of us are not able to see our families anymore. We saw a lot of our physicians and healthcare workers getting things like RVs in their driveways so that they wouldn't be coming home and exposing their families to risks. And so all of those normal constructs that are there for dealing with a lot of these issues have really come to play. And this is on the backdrop of an existing burnout problem amongst healthcare professionals that has been very real for quite some time, far beyond this pandemic. And so a lot of those issues have really come to light and come to a head as people have had to worry about things in such a dramatic setting. In the context of already pre-existing burnout, right? So physician burnout rates, for example, are very, very high. 70% of physicians say that they wouldn't recommend a career in medicine to their children. The physician suicide rate is higher than any other professional group in this country. These are all pre-existing problems that have really been exacerbated by a lot of what people have been forced to deal with over the last few months, whether it be in terms of their own personal health, whether it be in terms of what they're seeing with their patients, whether it be in terms of economic stresses, whether it be in terms of liability stresses. All of these things really come together to form a very tenuous environment for a healthcare workforce that was already in some ways at the edge.
Can I ask you both, we only just have a minute or so left, but just very quick things about some of the areas, at least Nisha, Mehta's legislation has been looking at. I don't know, Joann, what you've been doing on this or think about it, but our liability protections for the physicians, healthcare workers, and others involved. And I guess I see both sides. I understand the liability protections, but we also see a lot of stories out there of people that were turned away and didn't receive care and died at home. We see a lot of this in Houston. We saw some people in California that even were symptomatic, not turned away and whatnot. So I guess, how do you get to the right place where healthcare provision gets the right feedback, and sometimes liability is part of that, but yet you don't hold those heroes that are on the front line liable for the wrong things? How do you get that equity just right? And if you can answer it in real short form, I'd be so grateful. Let me go to Joann Gull and then Nisha Mehta. Joanna?
Not having that experience of having to turn people away, I think that there has to be a lot of community outreach and all, and we were very fortunate that our community really supported us, and it gave the staff, a lot of support and the willingness to go on, because they really understood what the situation was, and they did present. We did do a lot of outreach actually before. We were one of the first places doing testing outside in a tent in the ED. So, I think we did a good job there.
Yeah, well, thank you. Nisha Mehta, just 30 seconds.
Yeah, I mean, I think that there's also, I think the thing to keep in mind with malpractice and with liability protections is there's a difference between gross negligence and, doing what's right and trying to do the best you can under circumstances that are limited at best and that have significant challenges that haven't been faced before. So I think what healthcare workers are really pushing for is not just a blanket, anything we do is okay. They're pushing for, let's understand the fact that these situations are different and that protocols are going to change, screening examinations, things like that are going to get changed. And what we have to have is protection against, those very basic sorts of things. Obviously, gross negligence still has to stay on the table, but how do we make sure that we're not penalizing people for doing what they think is the best for their patient and really advocating for their patients and really applying some of those good Samaritan protections and trusting the fact that most healthcare workers are out there in good faith doing what they're doing on a daily basis to protect people.
Well, Joann, Gull and Nisha, Mehta, thank you so much for giving us some insights of what's going on the front line and for also taking us back about the tsunami of cases that began to hit us in Queens, one of the hardest hit and earliest hardest hit places, as Dr. Fauci just said, in the entire world. So thank you very much for joining us.
Thank you for having me.
Thank you.